Hi, everyone. Welcome back. I've been getting messages this week asking about the cyclospora diarrhea or the parasite diarrhea that's all over the news. And the first thing I want to clear up is it's not cyclosporin, which some people think it is. It is actually cyclosporin is actually a drug that is used to prevent organ transplant rejection, and cyclospora is a parasite that is causing diarrhea and is recognized lately as having caused diarrhea in like 31 different states. And at this point in time, there's about uh, 2,500 people who have been diagnosed with it. I want to talk about this specifically. By the way, I'm Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center and the author of the book, Healing When It Seems Impossible: 7 Keys to Defy the Odds. And I practice a blend of Chinese and Western medicine. And I'm going to talk today about an integrative approach to treating this parasite. Specifically, because this is a perfect example of the things that I do in my practice all the time. This is an illness that is not normally diagnosed with standard stool tests, and it can cause diarrhea, like watery diarrhea, and nausea and vomiting and weight loss, and it can last for a month or sometimes go in cycles for a long time. Another thing about it is that it's not spread from one person to another, so it's not contagious in that way. It comes from eating foods that have been contaminated with the spore. And a lot of those are foods that are shipped from places or packaged in a way where they're washed with water that may have the spores in it, or they're shipped from a place where the contaminated water has gotten into the plants. And so it can be a problem, and it can be a mysterious problem because lots of people don't know where it came from. There's over 2,000 cases, as I've talked about, and Michigan is really the main place where it has happened, but also Ohio and 24 other states are investigating cases. There are no deaths or hospitalizations. There are no deaths reported, and hospitalizations are pretty low given the case count. Um, but it's a very uncomfortable disorder and can cause a lot of symptoms. And how you get it is that it gets into raw produce when it comes into contact with water or soil that's contaminated. And it's usually through the supply chain, not because somebody had the disease and got it into the food. Foods like raspberries, basil, cilantro, bagged lettuce is one of the causes of it. And again, it does not get transmitted from person to person, so it's not easy to diagnose again. It's also doesn't easily get diagnosed in stool tests. And and so if you did a stool test and nothing showed up and you still had diarrhea, it might be because it doesn't show up in the normal stool test. And you would have to ask, can we test for cyclospora, which is a test that is not usually looking for the spore of the parasite. It actually looks for the DNA of the parasite or an acid fast stain, which is more difficult to order. Also, if you know of somebody who has ongoing watery diarrhea and got told your stool test came back normal, it doesn't mean that it's not there. So you want to get tested for the right thing. Now, I'm not antibiotic. The only proven method for treating this parasite is using sulfa or sulfamethoxazole, which is also known as Bactrim. And if you can't tolerate sulfa drugs, there are a couple of other drugs that might be a possibility, but the best way to treat this is using an antibiotic. So on a supportive, like doing integrative medicine, supportive methods will also help support it, which I'll talk about in just a second. Cooking produce kills the parasite. So if you suspect that there might be a parasite or that you've got food that does have a parasite, then you want to cook it. And it dies pretty quickly at 158 degrees, which is not terribly hot. And washing produce extensively can help reduce the risk. So, like if you do buy bagged lettuce and you want to eat it raw, wash it several times in plenty of water so that you can loosen any possible spores. From a Chinese medicine lens, and this is where Chinese medicine comes in handy, is that this is a damp heat condition, and there are acupuncture points that can help reduce the amount of discomfort and help reduce the diarrhea. Um, and so it's a good idea to come have acupuncture if you're gonna have this, if you have symptoms like this. And even though you have acupuncture, it may not technically clear the parasite. In Chinese medicine, also, we use herbs. There's an herb called coptis, and there are herbs like golden seal that may be helpful, but again, they're not proven to get rid of the parasite, so they would be an adjunct to treatment. You can also do electrolytes to stay hydrated. You can do gut repair nutrients like DGL, L-glutamine, zinc carnosine that help rebuild the gut lining after you've had it so that you don't have continuous ongoing symptoms. Um, the big takeaways that I want to leave you with is that acupuncture can be helpful. If you've got unexplained ongoing watery diarrhea, ask to be tested for Cyclospora. Don't assume a normal test is ruled any infection out. Wash your produce extremely well or cook it. And if you do get it, treatment doesn't end with the antibiotic course. Your gut needs support to actually recover. There's one other thing I want to say. One of the other reasons that this is such a mysterious problem is that the symptoms don't actually begin until 7 to 10 days after you've been exposed. So you may not actually remember what you ate that could have set it off. And that is one of the problems, is that it's hard to diagnose. It doesn't show up in normal tests. It takes 7 to 10 days to show up after you have been exposed, so you may not remember what caused it. I hope you found this helpful, and if you have any questions, please feel free to email me directly or write a note here in the comments. I look forward to hearing from you. Have a wonderful day.